It's Dr. Kenny Handelman here, and I'm coming at you from my office with just a little flip video camcorder. And basically, I just want to share a short medication tip with you. I'm just trying to figure out how I'm going to be delivering you some medication information. I'm committed to send you lots of medication updates over the next 3 or 4 weeks. And I'm thinking about doing some video, little short video messages. I'm going to aim to keep them to about 3 minutes, maybe 4. So it'll kind of be a short video message for you to teach you some things to help you with managing ADHD medication. And when I say ADHD, I also mean ADD. So today I want to talk about questionnaires. Now this is a questionnaire. It's called the SNAP-4, SNAP-IV for the Roman numeral 4. This is a free one that's available. We often use it for child and teen ADHD. And basically what we have, I'm going to zoom this up here, is we've got some ADHD symptoms here, and then over here we've got columns. 4 columns listed for not at all, just a little, quite a bit, or very much. And these are used by the doctor. If you're a parent of a child or teen with ADHD, certainly you've received this as part of the assessment. And usually doctors want to get one from the parent and one from the teacher, at least, at the bare minimum. And this helps to establish what the level of symptoms are. And it can help with diagnosis as well. Now, in adults, we often use the ASRS, which is the Adult Self-Report Scale, which is also a free one that can be used. Now, there are many ADHD scales out there that can be used. Some of them are for sale, so each time the doctor uses them or gives them to you to use, there's a price that's paid behind the scenes. It could be as little as $1 or $2 per questionnaire, or it could be $5 or $10 or more per questionnaire. These ones that I'm showing you are free ones, and you can get them online. The SNAP-4 for child and teen can be found at adhd.net. And that's free to download there. The ASRS, there's no specific site that I can tell you, but if you search online for ASRS, Adult ADHD Questionnaire, within Google, within the top 2 or 3, you'll find the questionnaire there. The ASRS is an Adult Self-Report Scale. It's somewhat similar, where you've got ADHD symptoms and then a rating. It's got a 1 to 5 for severity at the top. And then you rate the questionnaire, you rate the symptoms as to how you're experiencing them. So these are important tools for the assessment, and usually doctors use them in the beginning. I'm going to encourage you to have your doctor use it even more. You see, the important thing with treatment of ADHD, and I'm using the term treatment widely. That could be treatment with medications, it could be treatment with behavior therapy, it could be treatment with omega-3 fatty acids. It doesn't matter. The important thing is, if somebody's taking treatment, you need to measure the result beyond just a discussion of how are you feeling, are things going okay. So what I'd like to do is encourage you that if you do a questionnaire at the beginning, 3 months into treatment, get another questionnaire done, both by yourself as the parent and by the teacher. Or if you're an adult with ADHD, you do it yourself and potentially get a spouse or a loved one or somebody that you're close to fill it out as well, so you can get a second person's perspective on how you're doing. This is really analogous to blood pressure. If you are taking a blood pressure medication, or if you're exercising and trying to lose weight because of high blood pressure, your doctor's going to bring you back and measure the results. Are you doing well enough? And that's what we need to do with these questionnaires as well, to establish how you're doing now, and then going forward, how well is the treatment working. The risk is, of course, that if somebody stays on the same medication dose, particularly a child, so if they're on like Concerta 36 or something, when they're 8 and it works great, well, maybe by the time they're 9 and 10 they're still doing okay, but they've grown and 36 isn't enough anymore. But we don't realize that because still things seem okay. But if we did the questionnaires and the checklists every 3 months or 6 months at the latest, then we'd actually see that more symptoms were getting into the quite a bit and very much columns over time, meaning there's not as much symptom control. So think about the checklists, talk to your doctor about the checklists. You can search online to get free checklists. And actually, I'll see if I can add a link to this just underneath this video where you can go get those checklists for free. So by all means, please share your comments underneath this video. I'm just trying to set up this site in the best way to help you out. And please tell other people about it, that they can come and get free training about ADHD medication. So thanks very much. This is Dr. Kenny Handelman. Bye-bye.